Staffing challenges in the USVI public health system are still ongoing, as CEO of the Schneider Regional Medical Center, Tina Comissiong, explained during Wednesday's meeting of the St. Thomas and John District Hospital Governing Board. These challenges, said Comissiong, include a shortage of certified registered nurse anesthetists.
As mentioned before, staffing, especially nursing staffing, remains critical throughout all of our units. We currently have 67 of a necessary 179 full-time RNs, and we have 4 part-time RNs. Our staffing is currently being supplemented by a number of agency staff to include 24 travel nurses through contract, 21 PAFFORD nurses, and overtime with our existing staff. So far, recently, we've had one UVI graduate from the recent class successfully pass the NCLEX and agreed to join our team, and they will be onboarded in the next scheduled orientation. The staffing in the laboratory has improved, but unfortunately, we are still supplementing with PAFFORD and agency staffing to complete our lab staffing, which is extremely costly for us. We have engaged a new staffing agency called ProTouch Staffing Healthcare, which is going to assist us with permanent and direct hires of medical technologists to support the clinical laboratory services.
Though staff capacity was stretched in some areas, Comissiong shared that some new critical appointments had recently been made.
We are, however, excited to announce that Dr. Cecilia Pena will be joining our team in November as our 3rd anesthesiologist, which will complete the complement of that staffing. Work continues for recruiting permanent GI and nephrology team members. We are happy to announce our new radiologist who has specialty training in breast mammography, Dr. Mahogany Ambrose, to our team. We also welcome Dr. Danielle Comissiong as our new staff surgeon. The addition of Dr. Comissiong brings us up to a full complement in the surgery department. We're happy to announce that the lab specimen processor position was filled and that employee began in August. The addition of that staff will help us with our lab expansion that we have planned and with streamlining the lab processes that are in place. We onboarded a full-time physical therapy assistant, or PTA, this month. They're going to initially start out by helping us with our inpatient physical therapy caseload, and then gradually will assist us with the reopening of the cardiopulmonary rehab program. Respiratory therapy services has a few open positions, but they have 3 potential candidates in the interview process. We will be hiring, hopefully, 2 of those 3 to achieve a full complement of staffing for respiratory.
Comissiong said work was ongoing to develop marketing and advertising material to use in new recruitment outreach efforts. She noted that Schneider Regional had also identified several new outlets for advertising in the hopes of recruiting the necessary staff.
We recently participated in a recruitment fair at UVI where we engaged 35 potential candidates. From that group, we have selected a few individuals to fill vacant positions in hemodialysis, in information systems, and within the business office.
Meanwhile, the Schneider Regional CEO said SRMC hoped to recover costs for supplemental staffing. She said a project worksheet had been submitted to FEMA for the reimbursement of costs associated with acquiring agency and other temporary staff between March 2020 and June 2022 during the COVID-19 pandemic.